I didn't know anything about kidney disease.
Nobody. I know absolutely nobody that knew anything about kidney failure.
Man, you're kind of making me nervous about this. And he said, good, this is serious.
He told me when we were getting further on to needing a transplant, you've got 25 years left of life and your kidneys don't.
We're going to do everything we can to make it last for as long as we can. But at the end of that road, we're going to have to make decisions about dialysis or transplant.
I said to Jay, you know, I don't want to do this. And she said, why not? And I said, well, you're my daughter. And she said, well, that's the whole point. That's why I should. And then she said, would you do this for me? And I said, well, obviously, because I'm your dad. That's my job. And her answer was, well, it's my job now.
Prevention, trying to prevent people from progressing.
Once it starts going down that path, all we can do is we can minimize the damage with medication, change in diet, change in behavior in terms of like exercise and things, so losing weight.
Assuming after all that, and despite all the efforts, someone's kidneys do fail, what are the options? Dialysis and kidney transplantation. And in terms of transplantation, there's two options. Deceased, where someone dies and donates their organs and has that wish, and we honor that wish. And living donation, where a loved one comes forward to donate a kidney, or again, in a small percentage now, this altruistic stranger donation.
So it wasn't long in from the beginning that we knew that at some point you're going to need a transplant.
And living donation is a good solution. You have a much better survival rate, and it's much easier on the recipient.
Many years ago, you had to be a sibling or a parent or child, so a family member with a genetic match to make it better for the life of the kidney. Now we do know that people even who have no gene match at all are still going to have a very good outcome.
Because the outcomes, at least the 10, 20-year outcomes have been good, we've been now expanding the criteria a bit. So older patients, before we wouldn't accept them as kidney donors, now we are accepting older patients. We make sure we're ultra conservative and careful in who we select as donors, and that's why we have a very high standard on who we'll take and not take. Because we just want to make sure they don't get unwell.
The surgeons will say to you, and the social workers and the coordinators, we're not here to take a life to save a life. We want to make sure that you're absolutely healthy, absolutely in the clear, that down the road you're not going to run into trouble with your kidneys, that you're not down the road to getting diabetes, that you don't have any pre-existing conditions.
It's the unknown that everybody worries about.
I think people have a lot of fear about the surgery, about their future.
I think being afraid is natural and is normal. We expect that. And it's normal to be afraid of the process.
In terms of the medical risks, we divide them into two portions of time. One is the perioperative risks, and then the long-term medical risk. Because we select people who are quite healthy to become donors, the perioperative death rate is extremely low, but clearly that's something people need to know about. With any major surgery, it could be a risk.
In terms of medically, we're fortunate that if you have two healthy kidneys, if you take one out, the other one in fact compensates for the loss of the other. So it will grow in time. For example, if your kidney function is say 100, you're not going to go from 100 to 50. You end up going to about 100, from 100 to about 75%, because that other kidney compensates and grows over time.
But not just the medical stuff, you have to go to a social worker, and they make sure that money-wise you're fine, job-wise, that you're not doing this because you're being pressured, that you're not doing this because you feel guilty, that this is something you genuinely want to do, and that you're emotionally and physically and health-wise prepared to do it.
We don't want them to feel that once they've said, okay, I wouldn't mind being evaluated, does that mean I have to do it today? I mean, there's always outs. You can change your mind, and that's okay. And there's nothing wrong with that. I think just the act of saying I wouldn't mind being evaluated says something.
You're the focus. Your health is number one. The donor's health is number one. everyone's number one concern. They do lots of tests to make sure that you're going to be fine with one kidney, because that's their main concern. They also want to know that it's the right kidney for dad, that it's, fit, it functions well enough, it's got the right amount of vessels. But their primary concern is, are you safe? Are you going to live a long, healthy life? Are you fine with only one kidney?
They would make the initial contact to me that they are interested in donating. I'd give them a very detailed health questionnaire that they need to fill out. Health Canada is very strict in making sure that the donors are going to be healthy. Then they find out their blood type, and if they're able to go forward because the blood type is compatible with the recipient, we can then move to the next step. If they're not compatible with the recipient, they can still go ahead and go into the living donor paired exchange. Then we do the rest of the investigations. We ask them to collect their urine for 24 hours on a couple occasions. We get an ultrasound to make sure that they've got 2 kidneys present and that they're healthy. We do blood work as well to make sure that they don't have any infections or diseases. And then we bring them to see the whole team. So they see the nephrologist and the surgeon and the social worker and the anesthetist and myself for more education. And then they're approved from that process. And then we actually then go ahead and set up the surgery date after that.
What I was absolutely terrified of is that they'd rule me out as a donor. I wasn't nervous about my own health and safety. The doctors were looking after, am I going to be okay after? But I worried at each step, if the test didn't come back fast enough, I'd start to panic that it's because I wasn't a donor, or I'm not going to be able to be a donor.
To evaluate a donor takes about 2 to 3 months, and once we plan, we can usually do the surgery within the next month or 2.
We had actually gauged the transplant that close, and just by fluke, picked a date, and my kidney started to shut down that week.
We started doing the donors laparoscopically, so we went from an incision this long to bunch of incisions that long, and then maybe one about this big, right, kind of like a C-section, just above the pubic bone, and to take the kidney out.
Most people go home in a few days, particularly with these new types of laparoscopic surgery, and they're back to work in full function in about 6 weeks.
So that was a huge step forward, because not only did patients recover faster, the donors recover faster, they had less comorbidities with the surgery, less complication rates with the surgery, and the trauma was to their body was less.
I was only in the hospital 6 days. My daughter, they wanted her out after 2. She did manage to stay 2.5.
Your dad's doing really great, the operation's going really well.
But when you come to in the operating room, you actually know you're different. And there's not one kidney recipient that won't tell you the same story.
It is, I think I would tell people that it's major surgery, for sure. And for 4 to 6 weeks, you're recovering from major surgery. But it doesn't make any difference to the rest of your life. And for Dad, the difference was huge. It was just absolutely incredible to see a transformation from somebody who was sick to somebody who's so full of life, so vibrant.
So these patients, they could be on the list for many years because they may not be able to get a kidney transplant just because the match is so hard to find.
New avenue has been opened to them, and that is this registry that allows exchange of organs between families.
There may be somebody in Vancouver who's a perfect match for our recipient here in London. So we just, based on this mathematical algorithm, we can match several people and we can increase transplantation rate.
So what I would recommend to somebody who is in the run-up or thinking about donating, just talk to somebody who's done it. Get in touch with somebody who's been a living donor and they can put your mind at ease, because more than what the doctors and nurses can tell you, they can tell you about what it actually feels like and what their experience was and what they went through.
I applaud them after they're donated and they've got a glowing smile. They're like, yeah, I feel good. Everything worked out great. And you see that, you think, that's incredible. Like that person just changed that other person's life. Heroes are the ones in the other room who actually donated that kidney to that person, because that's an incredible gift.
I'll never be able to thank her enough.
I just don't see it that way at all. I see it as something needed to be done, and I could help, and he would do it for me. So I don't see it that way. And then other people do, you know, they say, wow, that's amazing. And how's your dad?
If you can get a transplant, and in the last 15 years, with the money that goes towards research, we might find some new way of fixing this.
The average time the kidney survives is around 18 years. So, you know, people can go decades now with viable transplants.
And I have run into numerous people that have had transplants and they're on 30 years now.
I have my old dad back. He's just like I remember him, if not better, with more enthusiasm and, you know, cracking jokes and full of life. People just kind of throw around the giving a life or save a life, but when you actually see the transformation in someone and you see the benefit, then you can see how important it is to help that person out and how easy it is. And it really is a miracle that I can live with one kidney, and not just live, I'm totally active. I can have a full, healthy life and make Dad feel so much better.
You can only measure the difference in the donor by their happiness. They are so grateful that they've been able to give life to someone else.
And to be able to tell that story for the rest of her life, it's pretty special. Special, special deal, eh, buddy?
Because it truly is the gift of life.
We have a transplant website, and on there's information in terms of who to contact. We encourage people to just call in, to be happy to talk to them about this process and ease their minds, and I think that's probably going to be where it starts.